Hello and welcome. Today, we'll be exploring a complex congenital heart defect known as pulmonary atresia. This condition affects the normal flow of blood from the heart to the lungs, and understanding it is crucial for both families and healthcare professionals. Join us as we delve into the causes, symptoms, diagnosis, and treatment of this serious heart condition. The exact cause of pulmonary atresia is often unknown, making it what's called a sporadic defect. This means it typically isn't inherited or directly linked to specific genetic factors. However, some cases are associated with genetic syndromes like DiGeorge syndrome, also known as 22q11.2 deletion syndrome. In most instances, pulmonary atresia appears to be a result of random errors during heart development in the early stages of pregnancy. Factors like maternal illness, medication used during pregnancy, or environmental exposures might play a role, but these are not definitively proven causes. Pulmonary atresia refers to a complete blockage of the pulmonary valve, the valve that allows blood to flow from the right ventricle of the heart into the pulmonary artery, which carries blood to the lungs for oxygenation. Because of this blockage, blood cannot naturally reach the lungs to pick up oxygen. This forces the baby's body to rely on alternative pathways for blood flow. One of these pathways is the ductus arteriosus, a blood vessel connecting the pulmonary artery and the aorta. Normally, this vessel closes shortly after birth, but in babies with pulmonary atresia, it must remain open to provide some blood flow to the lungs. In many cases, there's also an atrial septal defect, ASD, or a ventricular septal defect, VSD, holes between the heart's chambers that allow blood to mix and provide another route for some oxygenation. The severity of the condition depends on the degree of blood flow the ductus arteriosus and any septal defects can provide. Pulmonary atresia is a relatively rare congenital heart defect. Its precise incidence varies across different populations, but it's estimated to occur in approximately 1 in 10,000 live births. It accounts for a small percentage of all congenital heart defects, but its severity makes it a significant concern. There are no known significant differences in prevalence based on race or ethnicity. The signs and symptoms of pulmonary atresia are usually apparent shortly after birth. The most prominent sign is cyanosis, a bluish discoloration of the skin, lips, and nail bibs caused by a lack of oxygen in the blood. Other symptoms may include rapid breathing, difficulty feeding, fatigue, poor weight gain, and a heart murmur. In severe cases, the baby may experience heart failure, characterized by fluid buildup in the lungs and other tissues, leading to further breathing difficulties. Diagnosis of pulmonary atresia often begins with a physical examination, where the doctor will listen to the baby's heart and lungs. If a heart defect is suspected, further tests are needed. An echocardiogram, which uses sound waves to create a moving picture of the heart, is a primary diagnostic tool. It can visualize the blocked pulmonary valve and assess the size and function of the heart chambers. Other diagnostic tests may include an electrocardiogram, EECG, to measure the heart's electrical activity, a chest X-ray to view the heart and lungs, and cardiac catheterization, a procedure where a thin tube is inserted into a blood vessel and guided to the heart to measure pressures and oxygen levels. Pulmonary atresia can be classified based on the presence and size of a ventricular septal defect, or VSD. We have pulmonary atresia with an intact ventricular septum, and pulmonary atresia with a VSD. In pulmonary atresia with an intact ventricular septum, there is no VSD. The right ventricle is usually small and underdeveloped. In pulmonary atresia with VSD, there is a hole between the ventricles. This allows for some mixing of oxygenated and deoxygenated blood. In this instance, the pulmonary artery can vary in size and location. Treatment for pulmonary atresia typically involves a combination of medication and surgery. Initially, medication called prostaglandin E1 is administered to keep the ductus arteriosus open, ensuring blood flow to the lungs. This is a temporary measure until surgery can be performed. Surgical options vary depending on the type and severity of pulmonary atresia. One common procedure is a Bloch-Taussig shunt, which creates a connection between an artery and the pulmonary artery to increase blood flow to the lungs. Another option is a complete repair, where the pulmonary valve is opened or reconstructed and any VSDs are closed. In some cases, a heart transplant may be necessary, especially if the right ventricle is severely underdeveloped. Unfortunately, there's no known way to completely prevent pulmonary atresia, as the causes are usually random and unpredictable. However, women can reduce the risk of congenital heart defects in general by taking folic acid supplements before and during pregnancy, avoiding alcohol and tobacco use, managing pre-existing health conditions like diabetes, and discussing any medications they're taking with their doctor. The prognosis for individuals with pulmonary atresia has significantly improved over the years due to advances in surgical techniques and medical management. With early diagnosis and appropriate treatment, many children with pulmonary atresia can live active and fulfilling lives. However, they will require lifelong monitoring by a cardiologist to detect and manage any potential complications. Recent research is focused on improving surgical outcomes, developing less invasive treatment options, and gaining a better understanding of the genetic and environmental factors that contribute to congenital heart defects. There is continuous effort to push for newer, more effective treatments to improve the lives of those affected by pulmonary atresia.